So preparing for the night before and for the morning of surgery actually starts for some patients almost 2 weeks before. Starting 2 weeks before, we want to get patients off non-steroidal drugs such as Motrin, ibuprofen, and most particularly aspirin. Starting a week before, we like to make sure patients are also off other drugs such as Adderall, um, Ritalin, stimulant-based type drugs, and also get patients off some of their antidepressants as certain types of antidepressants conflict with the tumescent fluid we use for liposuction. So from a medical standpoint, 2 weeks, the nonsteroidals and aspirin. Also 2 weeks before, we try to get patients off some of their supplements that cause bleeding. A week before, we get them off other drugs such as Ritalin, Adderall, and some of their antidepressants. The night before surgery, the patients are actually going to have spent the day before hydrating aggressively, and that night, making sure they get a good meal. If they're having general anesthesia the next day, they're to stop eating at midnight. They're not to have any water or food. If they're having an awake procedure, on the other hand, they can have water and food. So the preparation is different depending on whether you're asleep or awake. Again, asleep, general anesthesia. The next day, you aren't going to be eating or drinking anything after midnight. Patients will have also spent the 5 days prior using an antibiotic ointment that a lot of orthopedics surgeons use to mitigate the risk of postoperative infection. We have them put this antibiotic ointment in their nose and their umbilicus starting 5 days before surgery, twice a day, and have them continue it in their nose for a week after surgery. The night before, you're also going to be taking a shower with a special soap called HipaCleanse. You're then going to dry off and use HipaCleanse wipes, which is the same type of antibacterial, more in a it's impregnated into a wipe, and you wipe that on, and it puts a film of antibacterial material on your skin that lasts several hours. The morning of surgery, you're going to shower one more time with the HipaCleanse, dry off, and use that same type of HipaCleanse wipe. Again, this significantly reduces the risk of postoperative infection. The morning of surgery, you're going to come in and spend about an hour and a half with our nurses, finalizing some paperwork and getting an IV started. When you're having general anesthesia, you're going to be seen by the anesthesiologist that morning, and prep for surgery. If you're having awake surgery, we're basically going to be doing something similar with our nurses, getting some medicines started for you by mouth to make your surgery more comfortable in the awake setting.